Thank you, Mr. Chairman. We're here at the 6-month anniversary of the Patient Protection and Affordable Care Act that was signed into law 6 months ago today by President Obama. As the ranking member on the Oversight and Investigation Subcommittee of this committee, I have written to Secretary Sebelius on a number of occasions, asking her, inviting her, imploring her to come before this committee to explain the process of implementation. Mr. Chairman, the committee needs to be in order.
Committee will please come to order. Gentleman deserves to be heard.
The proper oversight, that responsibility, is the responsibility of this committee, and that has not been fulfilled. If it has not become evident prior to now, please understand that I will use every tool at my disposal to ensure that there is vigorous oversight of the implementation of this law. Mr. Chairman, it took the chief actuary for the Center for Medicare and Medicaid Services a month to examine the legislation after we passed it. It showed a dramatically higher impact on cost than was previously disclosed. In fact, health expenditures would increase, not decrease, but increase by $311 billion over 10 years, a significant increase from the January 8th report released by the same actuarial office. Now, I questioned why Congress would pass legislation overhauling 1/5 of the nation's economy without satisfactory data and without hearing from the actuary. Was that timing engineered? Was there interference or, in fact, tampering with the process? Well, I don't know, but I believe the Secretary does. And, Mr. Chairman, we were told by the Speaker of the House that the House would have to pass this legislation so people could understand what was in it. I would submit that that quote actually should be that the House has to pass this legislation before anyone understands what's in it, because if anyone understood what was in it, they would not pass it. But nevertheless, only the Secretary knows if there was a plan to move this legislation without knowing the impact of total cost, and after all, I thought that was the entire point for hiring an actuary. Ranking Member Barton and I wrote to the White House on June 14 of this year, and I ask unanimous consent that that letter be included as part of the record.
Without objection.
And we received no response. Mr. Chairman, I have tried to work with the committee for another 6 weeks, and I've received nothing, so I introduced a resolution of inquiry.
What is the gentleman's request?
To insert a letter from Mr. Barton and I into the record.
Without objection, the letter will be made part of the record.
I knew that's what you were going to say.
On the 3rd of August, I received a cover letter attached to a short memo from Chief Actuary Mr. Foster saying his independence was never compromised. Now, I have no reason to doubt him. I take him at his word. I have every bit of affection and respect for the Chief Actuary of the Center for Medicare and Medicaid Services. But there are 3 substantive reasons why it is imperative that this committee support this resolution favorably and take seriously its activities regarding to oversight. First, a letter from a member of Congress to the administration should be treated with some measure of respect. This administration, unfortunately, chooses to ignore legitimate inquiries. A resolution of inquiry should not be the avenue to receive information, but it is the only means by which I have gotten any attention on this matter. What we did receive did not produce any documents or any questions in my original letter. By the Secretary's own admission, quote, "It raises many of the questions and concerns you raised," close quote. No, it did not. Regardless, this committee should not be satisfied with having some of our questions answered any more than we should be grateful for any reply. Both the letter requesting the resolution calling for information mentions specific documents to be turned over to the committee. Not one document has been produced. The administration needs to know when we say we want documents, we actually mean it. The active issue is, and the point, was there a planned effort to exclude the actuary from debate surrounding passage? We don't know. Only a full release of documents would allow us to know that the Secretary did not attempt to withhold information from the actuary or coordinate with others in the administration regarding the release of his report. The last reason, Mr. Chairman, is that you must work with us on this, is that we need to have proof for the American people. And they feel like they knew this all along. Congress had no idea on what we were voting that night. On the eve of the bill's passage, Mr.
Gentleman's
Foster...
time has expired. Do you wish additional 30 seconds? Can you complete your statement in that time?
Yes, Mr. Chairman.
Without objection, gentlemen. Be given.
Could I also ask for order in the committee? It is a little distracting.
Yes. Well, the committee will come to order, and the gentleman from Texas is given 30. We'll give you an additional minute.
Thank you, Mr. Chairman. On the eve of the bill's passage, Mr. Foster wrote that due to a very tight time frame, he could not fully analyze the cost and the efficacy of the bill before our vote. In the memo, Mr. Foster states, we received the reconciliation bill, which was publicly issued March 18, 3 days before the House vote took place. Because of the complexity of the legislation, it was not possible to estimate the bill's financial and other impacts before either of the House or Senate votes. Congress blindly voted to pass this legislation without knowing what the bill and its impact was. Mr. Chairman, I have laid out my case for us standing up for the oversight function of this committee and my subcommittee. While I appreciate the efforts to work with me, last time we agreed to work with you, the administration was actually not forthcoming. I need to know why the Secretary continues to ignore members of the committee and the subcommittee. I want to know why it takes an act of Congress to get a letter answered from CMS. And I want to know, is HHS afraid to provide documents regarding the passage of their healthcare law? This is an administration that ran on transparency, told the American people it was going to be transparent and open. This is a chance today to hold them accountable to that level of transparency. I urge favorable action on this resolution.
Gentleman's time has expired. The chair recognizes himself and